Hi, I'm Andrea, and I'm here to talk about my chosen question or issue along with my chosen theory for theoretical foundations. So, the issue or question that I had was, why do families or patients request extreme measures during the end of life care and healthcare? And according to Yi 2022, there's a lot of aspects that go into an individual's choice for end of life care or others who make the decision for them based on what they believe that the patient would want in the event that the patient is unable to communicate their wishes. And my chosen theory is Barbara Dossey's theory of integral nursing. This theory really takes into an account all of the aspects of a person's life to provide reasoning for their decision. Dossey's theory also includes spiritual, cultural, individual beliefs, and individuals' experiences that can also impact their decision. And this is according to Dossey 2008. So the intervention strategy articles that I found, the first one is from Cleveland Clinic 2022. It really talks about how in ICU and palliative care settings, there are several aspects that need to be taken into consideration, such as code status, life-sustaining measures, and then any products that are received, such as blood products, cadaver tissue, things like that, that can really impact a person's decision based on their beliefs. And then what consequences come from each of these interventions, or the consequences from not choosing to have one done. Breezy et al. 2019 also discusses the most important part of end-of-life care and how important it is to discuss with the patient about their wishes and measures that they hope to have or not to have. And this can really reduce any confusion in the event that they're not able to convey their wishes. And then Moynihan et al. 2016 also talks about the other factors to consider. What the patient considers is a good death. And a good death is essentially what is most important to the patient. And this includes pain management, goals, especially those that aren't orientated around finding a cure for the problem, just to find comfort, and the choice to choose no compressions, to reduce injury in the event of CPR, just kind of comfort measures, things like that. And the linkage between the clinical question, the theory, and strategies that I found, there are many choices that can be made during the end-of-life care, and having discussions with patients or family members and encouraging them to have the discussion with their family member who's the patient is really important when doing what is best for the patient and respecting their wishes, especially when taking into consideration their culture, spiritual, personal preferences. A person may choose something that surprises even the family, even though they think that they're very close. Especially in end-of-life care, people can make decisions that are very surprising. And this is what Dossey's theory really encompasses, all the aspects of a person's life. Like I said, personal experiences, cultures, beliefs, how educated they are by the nurse and other healthcare providers. So it really takes all of that and encompasses it into one. And the theory-informed concept model that I created, I put health at the center because it can apply to the overall person's well-being, and it can have a different meaning to each person based on where they are at in their health journey and what they find most important to them. Next, surrounding the patient's health is the nurse health again, an environment, and the nurse has a responsibility to not only help and advocate for the patient, but also to educate them on their options. And then especially if their health is declining, this can impact a person's decision based on what they find most important as well. And then their cultural and spiritual beliefs can impact what they choose based on if they believe that they should die comfortably over having a bunch of interventions done, all just depending on what their personal beliefs are. And then also social factors such as family and emotional perspectives. If a patient is younger and has children versus grandchildren, these can all play an impactful role in the decision of what a person chooses for end-of-life care. And then the next level includes aesthetic knowing, which considers the patient's thoughts on life and death and what they really value in the end. Social political knowing takes into account how much an intervention may cost, if their insurance will cover it, things like that. That can play a really big role in their choice as well. And then the last element is not knowing. If a patient is unaware of the consequences or benefits from a treatment, that can really impact their decision and make it more difficult for them to choose what is best for them. And then the appropriateness of the selected theory. I thought my theory really fit my clinical issue or question very well. I think it incorporated most of the things that are important when an individual is considering end-of-life care, and then what is most important to them. It can also be looked at from not only the patient's perspective, but the nurse's point of view when trying to understand what a patient is choosing, just because everybody has their own perspective on life. And I think it's very important to have a way to not only make decisions, but then understand other people's decisions. And it also considers things like life experiences that can be very impactful that others may not know that they've had. Balance of identified evidence. I think the clinical question was supported strongly by the research evidence that I found. There were several articles that went into detail about the need for having difficult conversations with family members and the patient themselves about what their wishes will be. And it was also brought up that education by the nurse can be very impactful in helping the patient make the best decision for them once they're fully educated on all of the possibilities. And then several articles also mentioned the importance of a good death that allows the patient to be comfortable and find what is important and specifically to each person that makes a good death attainable. And then implications for nursing. I think one of the biggest implications is the importance of nurses educating family and that the patient is aware of all of their options and the potential consequences of these. I had this happen in my family where my grandma, who was 96, was still a full code and she weighs less than 100 pounds. And none of the nurses or doctors or anything had talked to her or my mom about that until I got there and saw that she was a full code and had that conversation with her and my mom talking about what her quality of life would be if she was resuscitated after having compressions. It probably wouldn't be great. She's already 96. So I think that was a really big learning experience for me. And I would recommend that nurses have a conversation with all of their patients when they're admitted to make sure that they're okay with their code status and ask if they have any end-of-life wishes that they can help get that paperwork in order and submitted. And then if they are on end-of-life care, kind of asking them what's most important to them and what they can do to make them more comfortable. And as far as continuing research, I think there should be a study that asks patients if they know what a full code includes versus an altered code, and make sure that patients are educated on their options. I also think that it would be very interesting to survey patients who are on end-of-life care to see if they feel that they are educated fully on their options and if their beliefs and spiritual needs were taken into considerations before making any final decisions. And also if patients know what a good death is and kind of all of the different aspects that go into end-of-life care. Thank you.